To choose a treatment method, it is of course very important to understand at what level and where exactly this bulging, protrusion or hernia has occurred, as well as the size and direction of this bulge. Magnetic resonance imaging is, of course, extremely helpful. It allows us to answer questions such as, in which direction has the hernia or protrusion moved? What are the dimensions? Has there been a narrowing of the spinal canal? Has there been compression of the nerve roots? And at what level? Is there, in addition to the protrusion or hernia, any spinal instability or spondylolisthesis? And once we know at what level something has happened, and if we have a neurological examination, then we can choose the appropriate treatment method. Treatment methods: conservative and surgical, medicinal and non-medicinal. Medicinal and non-medicinal, medicinal and non-medicinal. Specifically, massage, therapeutic exercise, physiotherapy, baniotherapy, spinal traction, acupuncture, and pharmacological treatment. In cases where sequestration occurs or when there is severe compression of the nerve trunks, if the hernia is large, then of course surgical treatment is required. Not all methods are suitable for everyone. Each method has its own contraindications, and each method has its own advantages. The method therapeutic exercise is used well, it's very important, but we must know that it is performed at certain stages. That is, if a person is experiencing acute pain, no therapeutic exercise is indicated for them, it won't help, and they won't be able to do it anyway. Massage, yes, massage is important. Massage should be performed by a specialist. The specialist should assess where massage can be applied and use certain massage techniques and where it cannot be done, where it is indicated or contraindicated. And they should also take into account the patient's overall condition. The most advanced method for treating intervertebral herniated intervertebral discs, this is shockwave therapy. This method allows for a reduction in the size of the hernia. This protrusion, it can be seen on the MRI that is later performed on the patient, becomes smaller. This method helps improve the nutrition of the affected part of the spine, enhances the condition of the muscles that control the spine, and improves the state of the tissues. That is, the amount of collagen and elastic fibers surrounding the spine increases. The method of shockwave therapy consists of applying a shockwave to the affected tissue. In this case, we are talking about an intervertebral disc hernia. This is not radiation, nor is it electrical currents, but rather a shock acoustic wave that is specially generated in the shockwave therapy device. At our center, Azarat Medical, we use 3 applicators that allow the shockwave to penetrate to different depths, which makes it possible to tailor the treatment to each individual patient. So when the shockwave passes through the affected area and with MRI, we can see exactly where, that is, we know where to place the device and at what angle to work with the damaged part of the spine. When the shock sound wave passes through, it destroys inflamed, non-viable cells in the structures of the spine and stimulates the growth of new, healthy cells, fibers, and capillaries. In this way, the structure of the spine is gradually and carefully restored and brought back over time at the cellular level. You need to come to us once a week. The course consists of about 5 to 7 sessions. Between sessions, it is important to drink plenty of non-carbonated fluids so that the destroyed tissues are removed through the bloodstream and new healthy cells, fibers, and capillaries can grow in their place more quickly. In addition to shockwave therapy, and in cases where there are certain contraindications, as well as an independent treatment method. We use the method of dynamic spinal traction. We have a dynamic traction table called Sanmia Relax. It allows for smooth, gradual, and effective stretching of the spine. This reduces the pressure in the intervertebral discs. And the procedure is painless, even pleasant, lasting about 25 to 30 minutes, and it allows us to target different sections of the spine, placing emphasis on various spinal regions. And there is even evidence that the patient's height increases. This method also helps strengthen the muscles located near the spine, which play an active role in its movement.